Hello, and welcome to this meeting, which is jointly organized by CMI and Bergen Global here in Bergen and the evaluation department in Norad. I am Øyvind Bastøe, the evaluation director at Norad. And I have traveled to Bergen this morning to be here together with Ottar Mæstad, the director of CMI. The purpose of this webinar is to highlight and discuss insights and lessons relevant to the COVID-19 response in developing countries. This pandemic affects all parts of the world, not only related to health, but also related to jobs, transport, education, and the economy. Some countries, like Norway, is well equipped to tackle these challenges, while other countries, especially poor, indebted countries with weak public health systems, may face huge challenges. Lockdown measures may weaken the economy and worsen the social situation for many people, especially the most vulnerable groups. To respond to these challenges, many OECD countries, multilateral organizations, and international institutions have initiated support. While these efforts provide hope, I, from an evaluation perspective, worry that the pressure for urgent action can lead to critical missteps. Not all well-intended actions are effective. Some of the questions that can be raised are if these responses in a too much degree is influenced by what we experience in our own countries and not sufficiently adapted to the local context. Another question is if we are applying and using the lessons from past health systems and humanitarian crises. Yet another question is if we are able to strike the right balance between quick and flexible responses and coordination, quality planning, and context sensitivity. These are some of the questions we would like to discuss during the next hour. 3 international experts will share their views before we invite you that are following us to provide your comments and questions, and kindly use the Q&A function that you will find somewhere in your screen on Zoom. And then we will do our best to respond to these comments and questions. The first presenter today is Munzoul Assal. He is professor of social anthropology at the University of Khartoum in Sudan. The second presenter is Dr. Julia Betts, UK-based independent consultant with broad experience from humanitarian and development evaluations for the UN, for bilateral agencies, and for the development banks, especially in conflict-affected humanitarian and complex governance settings. And last but not the least, Ottar Mæstad, director of CMI, with broad experience from research management, and policy analysis, with a special focus on health, but also on many other issues. So then let me turn to Munzoul and ask you to give your presentation from your home in Khartoum. Munzoul, the screen is yours.
Thank you very much, Per, for this opportunity. I'm glad that we could still do this kind of work, despite the fact that most of us are still locked down. I'll try to structure my presentation around three key points. The first one is on the current situation with regard to COVID-19. The second with regard to Sudan health system and how it responded to the pandemic. And then my last point would be on what should the humanitarian regime do in situations like the one in Sudan. For the first point, as of today, Sudan has 4,300 cases. Out of those, there are 750 those who recovered, and then we have like 195 deaths. The numbers might not be that alarming compared to a lot of other countries, but if we take into consideration the health situation or the health system in the country, these low figures might actually suggest that we don't have enough testing, we don't have an efficient health system that would otherwise expose actually the actual situation. Within the country, there are variations, of course, with the bulk of the cases are in Khartoum, which is the capital of the Sudan. And the cases started, I think the first case was reported on 12th of March. And then on the 15th of March, the government started to put in place some measures to address the developing situation. And on March 15th, universities were closed, schools were closed, kindergartens were closed. And then 15 days later, our university ordered the staff not to come to campus. It was a total lockdown since March 29th. In April, the government took additional measures to allow people to move from 6 a.m. until 8 p.m. And then 2 weeks later, that was shortened. In Khartoum in particular, there was a total lockdown now for 3 weeks. From 1 p.m. we're not allowed until 6 a.m. the next day. This also varies from one state to another. In some of the states in the country where the cases are not that many, people are allowed actually to, go for their basic things from 6 a.m. until 3 p.m. But Khartoum is experiencing a total lockdown. Now, one of the questions that people are here asking is about the usefulness and practicalities of the so-called lockdown. And of course, you may know that Sudan is one of the countries where people have a very thick social interaction, where people mingle, where people greet each other. It's actually weird if you meet someone and you don't shake their hands when you greet them. And actually, this is something that people do almost spontaneously. You might meet someone 3 or 4 times a day, and every time you meet them, you greet them with shaking hands. So people are saying, in context like Sudan, the lockdown might not really work. And on top of all that, the majority of people are actually working in the informal sector. They don't have safety nets. So when you let them down, they're not allowed to go to work. And people are saying, how can we put food on the table if we don't go to work? Of course, the government tried to mitigate this situation by providing some safety nets, by paying some cash to the poor people, and also providing some food rations to the people in the peripheries of the town. But still, the government cannot actually reach everybody, especially given the fact that the economic situation in the country is quite bad at the moment. So these were some of the measures. But there are also another dimension that I should mention here with regard to the situation in Sudan, and that is the political dynamics surrounding the whole coronavirus and the lockdown. Some of you might have followed some of the debates that there are some opposition parties who early on doubted that there is actually a coronavirus. And, some even went as far as staging demonstrations, saying that the government is introducing the lockdown because it failed economically to address the problems in the country. And that is why it's using the coronavirus as a pretext to shut down people and not allow them to express their views. Well, of course, now they were proven to be wrong. And funnily enough, one of the key political leaders wrote an article 3 weeks ago laughing at the government by taking these measures, and he was saying that this is a hoax. 5 days ago, his in-law died of coronavirus. And the same politician wrote another news article saying that, well, it seems that this is serious, So you could see that there are different views on the situation, different dynamics. But again, this is also not far away from the whole political developments in the country, which Sudan has been undergoing since the overthrow of Bashir. We have a difficult transition. We have a lot of issues between the military and the civilian components of the government. The economy is not really doing quite well. And of course, the whole Sudan's position vis-a-vis the international community is yet another dimension that needs to be done. Now, the health system, of course, the transitional government inherited a very fragile health system. The previous regime was not really into spending into the public health institutions. They were, of course, private health institutions, but they were not as good anyway. So before actually the COVID-19, we already had a health system that's not functioning quite well. And the coronavirus actually has further exposed the health system in Sudan. And actually there were some reports to the effect that there are a lot of other death cases which were caused by other diseases, not the coronavirus. And that's also something that needs to be addressed and taken into consideration. So it's not only the coronavirus, but there are other things. My last point, which is what does the humanitarian system need to do to address the crisis brought about by COVID-19? I think the first and foremost thing that should be focused on is to support the health system. And this is quite critical. And as I just said, our health system is quite fragile. It needs a lot of support. And actually, at the beginning of the crisis, the health minister came out saying that just to address the COVID-19, his ministry is in need of $120 million US just for the COVID-19, not to mention other problems. So this is the first critical priority that we need to think about. Now, the other critical thing that we need to think about also when the talks about humanitarian interventions and assistance, I think if this COVID-19 continues, then we will be in a terrible situation because people will not be able to produce their own food. And there will be a serious problem. But luckily, at least in the countryside, people are still going, doing their own business, they're producing food still. But the situation is different in the big cities where the bulk of the population is actually there. So ensuring that there is enough food production and probably also making critical assessments or evaluations about the need that is caused by the coronavirus is, I think, necessary. And another area that also need to be considered when thinking about humanitarian interventions or support is that there is a need to support the capacities of those who provide services during the COVID-19 pandemic. Where these are health service providers, they need support. And actually, Sudan is one of the countries that is facing a lot of problems with regard to the provision of PPE or personal protection equipment for the medical personnel. And the medics are actually quite concerned that in lieu of this, they are exposing themselves to risks. And we actually had like 4 or 5 deaths, among the health providers. Finally, I think, as I mentioned, Sudan's position vis-a-vis the international community, especially the fact that the country is still on the so-called SST list, needs to be considered, because that's also one of the dimensions that would definitely negatively affect the country's capacity to address this pandemic. I think I'll stop here, and I would be happy to answer questions when they arrive. Thank you very much.
Thank you so much, Munzoul, for this report from the countryside, or from an African perspective in Sudan. Like Munzoul just said, use the opportunity to already now pose your questions and comments on the Q&A function in Zoom if you would like to engage in the dialogue. Now we're going to take a long step from Sudan to the UK and to Julia Betts. Julia has been looking at this crisis situation with the lenses of the lessons from previous humanitarian and health system crises. So let's turn to you, Julia, for your introduction.
Thank you, Per and Munzoul, and good morning and good afternoon, everyone. As Per mentioned, I was asked to look at previous humanitarian crises, particularly in health, to see what lessons we might learn for the COVID-19 responses. So I've drawn on evaluations, reviews, and other evidence, particularly from the Ebola crisis in West Africa, 2014 to 16, DRC, 2018 to 19, cholera outbreaks in Haiti, Chad, and Yemen in the last decade, and the health dimensions of recent or emerging crises in Syria, Yemen, DRC, etc. A lot of guidance and strategies and plans are now coming out from agencies on COVID-19 responses, so the lessons also reflect some of those dimensions. There are 8 lessons, and these are general lessons for program design. They're not specific to health interventions on which there's a big literature. And they are things which either didn't happen or which happened late in responses to other crises from which COVID-19 responses may learn. Let me share my screen so that you can see the lessons. First lesson, the importance of doing no harm. Something we learned from the Ebola crisis in particular was the real importance of not doing harm to vulnerable populations. So that involves aspects like having very clear institutional ethical frameworks, adapting those frameworks and preparing guidelines for local partners, building ethics into communications activities, which are so important in health crises, and preparing and updating risk management and mitigation strategies. It also means having data privacy and rights policies in place for digital technologies, such as many countries are using now for track and trace systems under COVID-19. Lesson 2, particularly for health crises, the importance of blending top-down planning with bottom-up approaches. In a health crisis, community-based models and approaches are critical. That means prioritizing community-level mobilization right from the outset, as we saw in cholera and Ebola responses. It means treating communication as a substantive response. Sometimes in Ebola, it was treated as an add-on or a secondary issue, and it really needed to be brought to the fore and substantively funded and prioritized. It's an important part as well of combating misinformation and rumor which was so important during Ebola. It also means ensuring that responses are designed and diversified around very specific local, cultural and social contexts. So really making sure that that very granular approach is embedded right from the outset. The third lesson that we've learned over time is about operationalizing what's called localization under the World Humanitarian Summit commitments. In practice, responses are delivered by local actors, that whether those are NGOs or other actors, and it means building close and well-chosen partnerships with these actors in whatever form they take, also taking into account power brokers and the private sector, as well as local research institutions and other local actors. It means really making sure that burdens and risks are shared. So rather than treating local actors as subcontractors, making sure that they're actual partners in the response. And that came through in the cholera outbreaks particularly. It means ensuring that resources are devolved so that local partners can make decisions and then act on them, streamline bureaucracy, and ensuring that decision-making authority is really well decentralized. It also means investing in local and national capacities, whether that's for equipment supply, as Munzoul mentioned in Sudan, or training for health workers. Lesson 4, and again, something that Munzoul mentioned, was really making sure that the staff involved in the response are protected, whether that's through PPE, but more broadly, making sure that duty of care policies and protocols are involved for all actors and are decentralized right down to the local level. That particularly came through in the Ebola crisis. Budgets need to be allocated for that, and partners need to be trained. And it's really important that accountability mechanisms are in place and that there are transparent procedures and sanctions. And that's something that didn't always happen in, for example, Ebola. Something else that has been useful in the past has been formalized mutual support mechanisms. So online communities where staff can share experience and some of their challenges that they face. The fifth lesson of 8, and Munzoul mentioned this very explicitly, was the real importance of grounding the response in the political context. So that means making sure that there is really good knowledge of local political economies. For example, in Ebola, there was a lot of input from anthropologists who knew well the local social and political context in the Ebola crisis, and making sure that there's a political economy lens throughout, including at local level. It means being aware of what the drivers of fragility and conflict might be. For example, conflict over resources, political affiliations and networks and so on. And it means really stress testing all the decisions that are taken, strategic, operational, etc., against the political dynamics, which often change over time and which can become very stressed in a crisis situation, again, as Munzoul mentioned in the Sudan context. Sixth lesson, as both Per and Munzoul mentioned, COVID, like all other health crises, are not limited to that sector. It's a social and economic crisis as well. Accordingly, something we've learned over years is the importance of making sure that responses are whole of government, whole of society, and multi-stakeholder, involving government, civil society, academia, private sector, the media, etc. Making sure as well that responses are multi-sector, so linking health responses to food security, WASH, education, economic development, etc. Another aspect that we learned from Ebola particularly is the importance of anticipating and treating subsequent social or economic impacts which may arise from health interventions, making sure that that's embedded in design, thought through in advance and planned for. Lesson 7. Investing in learning and performance assessment. Something we have learned from previous crises is that this needs to be built in from the start. It's not an add-on which can be bolted on later. So this means embedding and utilizing lesson learning processes and making those available to operational staff. Thinking about monitoring from the start and the importance and potential of using third-party monitoring, open source data, etc., mindful of ethical considerations. Making sure we learn from Ebola, particularly the importance of disaggregation, age, gender, ethnicity, disability, displacement status, etc. And for independent evaluation, which is often challenging while short-term responses are ongoing, really making sure that the timing, feasibility, and risk factors for that are adequately considered. Last lesson, Per mentioned at the outset, short-term responses. We have learned from previous crises the importance of adopting a medium-term lens. So making sure that short-term responses are linked to recovery right from the start. This might mean links to existing systems in place, like social safety nets, social protection systems. It might mean prioritizing a systems approach to healthcare support, as Munzoul mentioned. And it means integrating capacity strengthening on a range of levels. Something that's often gone wrong in the past has been one-shot training activities when what's really needed is multi-level systemic interventions. Let me stop there and thank you for your time.
Thank you so much, Julia, for sharing these important lessons. We are still in early phase of the virus crisis in many countries. And there is a good question if we have sufficiently learned the lessons from previous crises and similar situations. And I think that this is a question that maybe you who are following us out there also have some views on. Do you think we have learned from the past, or are we still approaching this from a different perspective? I'm not quite sure if you are going to respond to that, Ottar, but anyway, we're going to turn to you now. And Ottar, as I said, is also here in Bergen at CMI in his home office. So Ottar,
yeah,
please.
Thank you, Per Øyvind. My plan was to comment more on the Norwegian response, to share a few reflections around what we have seen so far in that respect. I think overall what we have seen so far is a response based on very sound principles. It's a response that encourages coordination rather than fragmentation. It's a response that tries to build on existing channels rather than building new ones, like it was done in Ebola with not so great success. And it's a response that acknowledges that this is both a health crisis and it's a socio-economic crisis. And there is a focus then on maintaining other health services. It's a focus on maintaining education services and ensuring food security. So on balance, these principles look great. There have been many decisions, of course, made under very limited information. Although we are not at the stage yet to evaluate what was right and wrong, I think it's fair to raise some questions and try to reflect now, in light of new information that's coming in, whether we are on the right track. And I want to comment on three particular things. And the first question I want to raise is whether we've been able to strike the right balance between the health response and response to the socio-economic crisis. Looking at later estimates about the magnitude of the health crisis, I'm going to focus on Africa in particular. The latest estimate from the WHO is that COVID may kill around 150,000 people. That's many people, but it's relatively speaking few people compared to other health challenges on the African continent. Malaria kills 400,000 every year. Tuberculosis kills 400,000 also. Diarrhea 600,000, and HIV/AIDS 700,000. So this is a continent with major challenges. And if you compare the disease burden and taking into account the number of life lost, you know, the difference is much bigger even than these figures indicate. So in that respect, the COVID-19 is not that huge compared to other health issues. Compared to the more socio-economic side, it's also interesting to look at the estimates on how this crisis may affect poverty on the continent. And the World Bank's estimate, which is on the lower side, I think, among the ones that are out there, estimate that there may be more than 20 million more people in sub-Saharan Africa in extreme poverty as a result of this crisis. And, you know, when you compare those numbers, you know, it seems clear that this is above all a socio-economic crisis at the moment. So the question, are we responding adequately to that? And I looked briefly now at the figures in the revised national budget that the Norwegian government put out. And those figures indicate that the Norwegian response is quite opposite to that. Actually, it's a much bigger emphasis on the health response rather than the socio-economic response. The major initiatives on the socio-economic side is the IMF debt relief grant. The UN fund that's put up is also targeted partly to socio-economic issues, but overall the response on the health side is much, much bigger. I think it's also very interesting to look at how we ourselves have responded to this in Norway. We are now spending this year 400 billion kroner from the oil fund in extra inducement to the economy, 400 billion. How much of that is for increased health effort? It's only 1 to 2%. The rest of that is for the socio-economic crisis and to target that. So I'm not sure that we have adequately balanced this. Important thing, of course, is not what Norway does, but what is done globally. So we must take that into account, of course. Second question I want to raise is whether it was a smart thing to invest in vaccine development. Definitely vaccines is immensely important wherever we are in the world to end this crisis. And normally we spend aid money on vaccine development when there is no market out there for the vaccine. And vaccine development is immensely costly. And even if the vaccines are needed, you know, you need someone who can back up that investment. In this case, the picture is very different. You know, there is an enormous demand for this vaccine from high-income countries. And the question is, was it a smart thing to use aid money at all on this? Wouldn't this come along anyway? Of course, what is extremely important is that when the vaccine is developed, that it is made available to the poor countries. And it might perhaps be argued that being part of the production could make it easier to also provide access in the end. But it seems like a risky strategy. At the moment, there are more than 100 vaccine candidates out there, and with aid money, we are into, I think, 8 of those investment efforts. And there's a high risk, of course, that someone else succeeds, and you are not able to come out here with a successful one with aid money. The other thing, of course, is that there are contractual issues here. So it's difficult to write binding contracts with the producers that they will be vaccines will be made available. And particularly, it's turned out that US legislation is not particularly favorable around it. So it's a risky strategy. So the question is, would it be better to put all the money into Gavi or other organizations that focus on making vaccines available when they first come out? On top of that is, of course, the question about, is it at all legitimate to use aid money on this? Because this is, after all, aid for ourselves to a large extent, and does it comply with the OECD DAC regulations, etc. So that's another discussion. Last thing I want to mention is about, Norway went early on ahead and established a UN-funded trust fund for a coordinated effort within the UN. And on the face of it, that's looked great. It contributes to coordination rather than fragmentation, pooling the money. But now looking at how those funds are spent, it raises some questions, I think. It has not been able to raise a lot of money in that fund, and that's spread fairly thinly now on almost 20 UN organizations all across the board in almost 40 countries. So thinly spread on a number of things. It doesn't seem to support the more focused strategy that is in the principle of the Norwegian support. So I'm unsure about whether that was a right move. I think when we now look forward, let me end with that. When we now looking forward, the most important thing, one of the most important things is to target the response adequately to the needs in the various countries, and they differ. And there is not yet much systematic evidence on exactly how this is affecting health system, exactly how it's affecting the socioeconomic situations of vulnerable groups. And I think it's extremely important now to collect that evidence systematically. In every crisis, there is a lot of media attention. It's a lot of organizations that talk about their case and so on. And I remember from the Ebola crisis, I was looking at that from a distance, and I was overwhelmed by these messages about health workers fleeing the health stations, that the health system broke down. When you look at the data more systematically, that was not what happened. There was a decline in health service provision, between 15 and 20% maybe, but that is not a collapse of the health system. And we also have a lot of blind zones, of course, in this. I have heard now in this crisis many that are concerned about TB patients, about HIV patients, about malaria. But looking at the evidence from Ebola again, malaria services was least affected by the crisis. What was most affected was services for inpatient, including mothers who delivered at the facilities. I haven't heard so many crying out for the inpatients. That is a more diffuse group. It's something that's provided through the ordinary health system, not through international vertical initiatives, so on. So we need to be out there and look at the data and monitor very closely what is going on to do the right thing. Okay.
Thank you so much, Ottar, and thanks to all the panelists for sharing different perspectives on what this crisis is about, and especially the response from Norway, other bilateral donors and multilateral organizations. So now it's up to you if you would like to comment or to raise any questions to the three panelists. Let me try to follow on the screen also. I think one question that came up, it disappeared suddenly. It was related to the let me see. Since it is now defined as a social economic crisis, why not look to evaluation on such issues from the HIV/AIDS pandemic area, and that determine which special initiatives have played critical roles in reducing suffering, stigma, and providing care and medicines to affected families and education and social protection for children in particular. Julia, do you have any views on this? I mean, I was thinking about the same. From the crisis responses that you have looked at, is this crisis similar or different from these other crises? Is this indeed not health crisis, but more a social economic crisis? What's your take on this?
I think it would be a very courageous person that said COVID-19 was not a health crisis. But indeed, as you say, and as all of us have signaled, it does have very strong social and economic dimensions. And we see that in all the responses that are occurring, with governments putting millions and billions of euros and dollars and pounds into social and economic support measures, in order that in some of our countries, economies don't close down while we address the health dimensions. In terms of evaluations and lessons from the HIV/AIDS era, absolutely. In many ways, those are now older and they are slightly more dated, but there were a lot of lessons that came through from the responses to HIV/AIDS, not least on international coordination, search for a vaccine, which in that case proved particularly challenging, and the importance of communication and messaging, which informed subsequent responses like to Ebola, for example. So my own feeling is that that era of evaluations have informed subsequent responses from which a subsequent chain of evaluations have been done. But yes, the lessons from that era are important and significant. Perhaps Munzoul would want to comment from Sudan.
Yeah, let's turn to you, Munzoul, and to also describe how you see the crisis. And I mean, is this primarily a social economic crisis? And maybe to add the question on top of that, the concern from our side and what Ottar mentioned is the question: are we adequately targeting the real problems at the country level, or are we missing the target? So what's your take on this currently in Khartoum?
Well, I think, of course, it's always a very good idea. Actually, it's a must that people should learn from previous evaluations, from previous ways of responding to similar pandemics. And certainly HIV/AIDS is one of the things that people could learn. Although I could say that there are, of course, variations, differences, between HIV/AIDS and the COVID-19. COVID-19 is, certainly a health problem, but more so it's a socioeconomic problem.
Munzoul, there are some noise on your microphone. Maybe you can move your microphone closer to.
Well, I was saying it's of course important that we learn from the previous evaluations and the previous responses that people have had with regard to other pandemics like HIV/AIDS. Of course, there are differences in the dynamics of the two pandemics, and I think COVID-19 is a health problem, but more so, as I just said, a socioeconomic problem, which requires a socioeconomic response, especially for countries or regions in the world where their systems are not really matching enough to the severity of the pandemic or the gravity of the situation. And this actually, here comes the necessity of learning from previous evaluations, from previous responses, and also the responsibility for the humanitarian regime to do something on this, because obviously this is something that is quite difficult. It's something that can get everybody and all of that. But more so, as I said, to the countries or regions that are not really well prepared in terms of health situations and in terms of the economic conditions in those countries. So yes, definitely there is a need to learn, there is a need to coordinate, and there is a need to make sure that the socioeconomic implications, especially in the poor countries, are addressed.
Ottar, you have looked at the Norwegian response and at the current revised national budget. And you have seen that funds have been reallocated from other programs and other initiatives to this COVID-19 response. Of course, you haven't done any research of this yet, but what do you think is the effect from a development assistance perspective? Do you have any or see any dangers in this huge reallocation of funds?
Yes and no. I think when you look at that, the revised national budget, paragraph by paragraph, you see that most of these reallocations are caused by, there are projects that cannot be implemented as planned because of COVID-19. And it's of course quite sensible to reallocate those money to other places. And most of the areas, I think that is what is taking place. There are a few other areas. I think it was education. I think it was there's a knowledge bank. A few areas where it said that here's a reduction to fund the COVID-19. I think it's way too early to say anything about the consequences of that. In the big picture, of course, these are marginal money. It's quite small money in the big picture anyway in this situation. So I mean, if you're talking about a proper response to the socioeconomic crisis, millions of people out in poverty, it requires huge amounts of money, and the response packages in developing countries have been very, very small relative to their GDP compared to Norway, because they have that opportunity, of course, and many of them are indebted and don't have the fiscal space for this to really address that part. It requires huge amounts of resources, and I don't think we are anywhere near a proper response to that. So I think in that picture, I think it is not a big problem to reallocate towards this challenge. I think some reallocations should be done. Whether it's exactly the right balance, it's of course impossible to have a short answer to.
As an evaluator, my concern is often that we are not learning enough from what we're doing in development assistance. We seem to run away and run fast and not being able to document and systematize our experience as we go along. So the question, and I guess in the situation, what is different in this situation today than in any past responses is that we're better connected in the world now, and we have better possibilities to interact and to share insights and lessons. But maybe let me ask the three of you, what do you think we should do in order to make sure that we really learn something from this crisis? This is probably not the last big health system crisis we're going to experience. So what can we do to make sure that we capture the lessons and are able to use them for future crises and future generations. Any views on this? Julia, you have done evaluation in so many, you have done post-evaluation of so many crises. How can we go about to do it more like a real-time evaluation or monitoring effort?
Okay, I think I would be a little less negative than you, Per, on the lesson learning. I think what we observed during when we come in afterwards to do evaluations of these exercises is that actually there's often been a lot of lesson learning ongoing. That's usually internally, whether it's to the agency or the government or the civil society or whatever, but it's often there. It's just not often distilled and shared externally. So I wouldn't be so negative on that. I think there are a range of mechanisms available. There are internal agency and government lesson learning mechanisms. There are things like operational peer reviews within the UN system. There are various analytical meetings where people sit down and plan. Often the gap is between the lessons and the change programmatically. And that's really about building in adaptive management right from the start and making sure that flexibility is there and that donors are willing to embrace that adaptation as needed by having flexible funding lines. That's so important. I'm not sure whether what used to be called real-time evaluation is, there were challenges with some of those previously, although they can be a useful tool. But in terms of ongoing mechanisms, maybe it's about maximizing what's there from existing mechanisms and really making sure that that's captured and distilled and then shared collectively among whether it's the humanitarian community, as Munzoul mentioned, but really all the partners involved in this at all levels. So I would say the first step is to examine the existing mechanisms rather than seeking to generate anything new, making sure that those are maximized. And if people do want actual evaluations rather than reviews, considering whether those can be done more flexibly, maybe deploying a mix of external independent evaluators and agency staff. If you want a fully independent team, maybe setting clear boundaries around whether it's a review or a full-scale evaluation that you're doing, defining the parameters very clearly and setting a really clear time limit that you want the report 3 months after the response, for example, or during the response even on a 3-monthly basis. So just clarity on what's needed, I think. Thank you.
I think there is many interesting things going on in this area now. I think COVID-19 has mobilized the research community, far beyond the evaluation community, to monitor the situation. And there are so many initiatives now that are trying to look into various aspects of this crisis all over the world. And I think there is a lot of interesting things going on in terms of data collection, and that is not limited to the programs themselves within the program, and that learning that takes place within aid-sponsored programs, but learning that about the situation and how it is evolving. The World Bank is doing phone surveys now in almost every country in the world to monitor the socioeconomic situation. The World Food Programme is monitoring food security in a large number of countries on a day-by-day basis. Of course, we are in a very challenging situation because the health crisis in itself limits the ability to go out there and collect data. So this has to be based now on phone surveys, which are imperfect, but still much better than nothing. So I think the combination here about those broad-based monitoring of what is happening in society, combined with following the interventions in themselves, is a very promising thing to do, and that can be done, a lot of it, as it happens.
I'm glad to hear that, this optimism, both from you, Ottar, and from Julia. So let's hope that we are changing. We're able to learn. So as we move forward, and that would be fabulous from both the evaluation perspective and the research perspective. We have 2 questions, and we are getting towards the end of this hour. one question is the problem in target or to allocating funds at the community level. So is there any research on how we can turn the trend around from looking at, I guess, the country or the central level always, and not being able to channel funds to the community level? So that's one question. And another question is that is regarding the humanitarian coordination. What kind of actions and leadership needs to be in place to have the sufficient humanitarian coordination during the COVID-19 crisis? So if you could please keep these two questions in mind when you spend 1 minute each for your closing comments. So let's repeat the same order: Munzoul, Julia, and Ottar. So Munzoul, you have a minute for any closing comments, please.
Well, I think I would just support what Julia and Ottar said with regard to the lessons learned. I think there are a lot of levels, and the first level that we should think about is the country level, because there are different bodies that are responding to this pandemic, and then the starting point is to know how these different bodies are coordinating, what they are doing, and all of that, and then you move further to the other levels. Now, with regard to the community level and the economic part of it, I think this is all dependent on what Julia was saying about evaluations, about real-time evaluation, about what Ottar was saying with regard to monitoring the situation and all of that. You cannot provide any support without these kind of background works, and I think this is quite necessary. I also saw a question about the coordination of the different humanitarian actors. I think this is one of the very critical and very difficult fronts, because there are too many actors with different interests, with different specialties, and all of that. And I think I would definitely go for the suggestion that let us try to strengthen the already existing channels. I'm not going to bring new things that would require a lot of attention and a lot of energy and all of that.
Thank you so much.
That's my response.
I think that's a good advice to use the existing structures and actors. Julia?
Yes, very briefly, thank you. In terms of whether and why adequate funds are being directed to community level, I think we don't have a view on that in research terms globally. And I think from what we can see anyway at this stage, it's going to be really, really important to keep domestic politics from donor countries out of the humanitarian response. They are separate, different, and they, we should ensure that we know that the lessons from the past indicate that we need very, very strong financing modalities and decentralized fundings to the local level. We have to make sure of that. On humanitarian coordination, well, the system has undergone a lot of change in recent years, and those changes are just starting to bed down. And what's needed are the ingredients really that those changes are aimed at in enhancing. Things like very strong coordination from an empowered country team, very clear roles and responsibilities, the ability to make decisions in country, and critically, flexibility and willingness to absorb risk from the donors who are providing that money. Thank you.
Yeah, thank you for that question about financial resources reaching the community. I think in order to address the socioeconomic part, particularly the poverty part, what is needed is cash in the pocket of poor people. And there is a lot of talk now about health emergency preparedness and so on. What we lack in the world is poverty emergency preparedness, and a system for quickly distributing cash to poor people when they need it. And I think this crisis shows that. And countries are at various stages about this. I just saw a report now from Peru where they have done this program. They have distributed cash to people. But most of the people don't have a bank account, so they go to the bank and crowd together and increase infection there. So I mean, to establish ways of distributing cash to people in a crisis, that's definitely one of the things that we need to prioritize as we go forward.
Thank you so much, Ottar, and thank you, Munzoul, and thank you, Julia, for participating in this hour to share your insights and lessons on the response to the COVID-19 crisis. Of course, we haven't been able to raise all the relevant questions or to respond to all the relevant concerns, but these are certainly some of the issues we will struggle to address in our research work, in our evaluation work as we move forward. So thanks to all of you that have followed us, and please feel free to share the recording from this webinar that you will find on Bergen Global YouTube channel. So thank you to everyone.